This video will demonstrate how to complete the Wound Assessment Integrated Care Pathway. Accurate and regular assessment of wounds is essential when producing and evaluating wound care plans. The Wound Assessment Integrated Care Pathway is based around the Time Wound Assessment Framework, which is an acronym requiring the practitioner to consider tissues, infection, moisture and edges as part of a holistic assessment of a patient with a wound. This is the Wound Assessment Integrated Care Pathway. It is 7 pages in length and should be used for all open wounds regardless of etiology. The first page contains information on the time framework in addition to information on how to refer patients to the Tissue Viability Service. Please note most wounds should be managed at a ward level. Wounds only require specialist input if they are complex or are grade 3 or higher pressure ulcer. If you are unsure if a referral to a specialist is required or which specialist to refer to, please discuss with a senior or link nurse. The second page contains a signature bank which should be completed by all staff who document in the pathway. There is also space to document when patient information has been given. It is important to give written information when possible to ensure our patients can make informed decisions about their care. Page 3 contains space to document which specialists relevant to wound care the patient has been referred to. There is also space to document Doppler results for vascular patients. At the bottom of the page, the dates when medical illustrations have been obtained should be recorded. If you do not have access to the patient imaging system, please visit the Tissue Viability Intranet Resources page where there is information on how to get access to the PACS imaging system. Medical photography is essential documentation on wound care and also aids with wound assessment. Page 3 contains a body map. Please record all wounds on the body map. Page 4 contains the time assessments of each wound. Please complete the assessments as shown in the video. Tissue proportion should be documented as estimates. This helps guide dressing selection to ensure optimal wound bed conditions are obtained for healing. Key signs of infection should be documented if present. Please note wound swabs are not required at every dressing change. They should only be sent if there are clinical signs of infection. Any signs of infection noted should be reported to the medical team. Assessment of moisture is critical to ensure the dressings are appropriate. Dressings should not need changing every day. If the dressing frequency is too high due to high exudate, then a more absorbent dressing should be considered. Wound edges should be assessed and measurements taken of wounds to allow evaluation of healing. Surrounding skin condition should be assessed. It is important to aim for a healthy level of moisture in surrounding tissues. Too dry and moisturised should be considered. Too wet and barrier products should be considered. Finally, pain should be assessed. Wounds are often associated with pain which may impact patients' quality of life and may be a sign of infection. Please note if the wound is static, improving or deteriorating. Review previous photographs on PACS to help determine this or discuss with colleagues who are familiar with the wound. If the wound is static or deteriorating, the wound should be discussed with the medical team and/or specialist nurse. Page 6 is where treatment plans should be documented. This may be completed by any staff who use the pathway and should only be updated if there is a change in management plan. The final page is for documenting dressing changes and any additional information relevant to the management of the wound.